thought I had this up and it timed out, so give me just a moment. Thursday, we will meet in the lab. We will meet downstairs in the lab. And I will give you your lab sheet for the lab final, okay? And we'll look at that. Okay, I'm just a little out of sync today, so half a minute to do roll. Excused. Is Lane coming in? Do you know? Maya, Anna, Tara, Emily, Shelby, Noemi. Caroline, Jordan. Ashley, is that you underneath all that?
That's Ashley.
She's gonna bop me. Grace and Leandria? No. Okay. So this is, are you gonna do that?
We had to do it.
Sorry. Cute. Do not hand me one, please. I had lobster mac in Boston.
Thank you, Amaya.
So good. Thank you. So anybody that would like to get that? They would like to have sugar, please. Thank you very much, Mike, for thinking of us. So, yes. He is coming? Okay, good. So I find this statement extremely interesting because it's so true and it's probably something you've never considered, okay? Your digestive tract, actually, it's just sort of sitting in your body, but it's really part of out here. And what do I mean by that? I love this. If I could just reach over and tell Macy to open wide and grab her tongue and just pull real hard, then we're gonna have the tongue, the esophagus, and stomach. Then all of this is your small intestine. It's just all wadded up in here, okay? And then your large intestines, then your rectum, and then your anus. So it's a tube within our body. There's no actual opening other than your oral cavity and then your anus, okay? Everything is absorbed through the walls. There should not be any connection, any opening. And if you should have an opening, then it can be very, very serious, okay? And we'll talk about that the further we get into it. But that's really and truly the way I want you to think of it, is that you just grab that old tongue and pulled it all out, and it's supposed to stay within itself, okay? The food materials, all the food, whatever you put in your mouth and you decide to swallow, that enters into your digestive tract will be broken down into its building blocks. You should recognize this right off the bat. The big four. Carbohydrates are going to be our sugars. The building block will be glucose, our simple sugars. That is our immediate energy. We have fatty acids and glycerol that are lipids, and that is our stored form of energy. We have proteins that are broken down into amino acids. That's going to be hormones, enzymes, and then we have nucleotides, which will be our genetic material. Everything has to be broken down into its simplest part. And then once it's on the other side, once it has absorbed through the small intestines, then we start the rebuilding. The cells will rebuild and package things together, whatever your body needs, okay? But it must be broken down. Once the building blocks are absorbed across the wall of the digestive tract, then they're going to be used and we build again and make whatever our body needs for each cell, okay? So when we're actually looking to define digestion, it is the mechanical and chemical breakdown of food. The mechanical and chemical breakdown of foods into a form that our cells need and that they can absorb. Digestion is the mechanical and chemical breakdown of foods into forms that the cells can actually use and absorb. And there are actually two parts to digestion. There's mechanical digestion. When you use a fork or a spoon, or maybe you just hold it in your hand and take a bite. What did you do immediately with that bite of donut? What did you start doing? You started chewing. Why? Did you not want to swallow that whole big bite? No. You wanted to start the mechanical breakdown of that lovely, I may have to get one, bite of donut, okay? And that doesn't involve chemical digestion. That's just mechanical. Then further on in the process, you're going to see that chemical digestion will occur, and you will actually begin changing the food particles into simpler chemicals, okay? The organs of the digestive system will carry out this mechanical and chemical digestion as well as ingestion. That's just eating it, biting it. We've got to get it down our tube, so propulsion, absorption, and then there are going to be things that we eat that are not useful. Okay, and we're going to package those in the large intestines, and then we're going to get rid of those as waste, and that would be defecation. Okay, we primarily have the alimentary canal and then the accessory organs. I love this little guy. On this slide in very small print, there's about 10 exam questions. So we're going to use this kind of as our overview. We're going to go over it. I realize it's very small font, and we're going to get into it as we go along. But as an overview, notice that on this side you have your organs, the parts of the alimentary canal. This side you have accessory organs, okay? So So we're actually going to start with our mouth, our oral cavity, and we already recognize that that is where mechanical digestion begins. What you may not have thought of, and I need you to recognize, and I'm going to highlight it, is that the mouth begins the chemical digestion of carbohydrates. The oral cavity is where the chemical digestion of carbohydrates occurs. Okay, you need to know that. Beloved students, where does the chemical digestion of carbohydrates begin?
In the mouth.
Perfect. So if we are looking at some possible accessory organs, we have salivary glands. We're going to look at 3 of them. And salivary glands secrete saliva. Remember, you used to call that spit. It is now called saliva, okay? And important for this is that in your saliva, you have enzymes which will initiate the breakdown of carbs. That is chemical digestion of carbs. The salivary glands, the secretions of the salivary glands, have enzymes that will initiate this chemical digestion. This next structure is called your pharynx. Pharynx. Did anyone hear me say pharynx? No. The last little part, all of those letters, you smush in one, and it's pharynx. Pharynx, okay? That's your throat. That is the official term for the back of your throat, okay? And it's going to literally connect your oral cavity, your mouth, with the esophagus, okay? Your esophagus is simply a passageway. It's just a place that your food is going to move to from your oral cavity into your stomach. Your stomach. Now remember that the combining form for stomach would be gastro, okay? So if you say gastric, gastro, whatever added to it, then you know that we're referring to the stomach. The stomach is a happening place. There's a lot going on in your stomach, okay? It secretes acid and enzymes. A lot of mixing, shaking up, and everything is going on, but this is what I need you to know, that the chemical digestion of proteins begins in your stomach. Where does chemical digestion of proteins begin?
The stomach.
Where does chemical digestion of carbohydrates begin?
The mouth.
Okay, your oral cavity, your mouth. So you need to expect those questions. So, there's a lot going on right in here. This is your stomach. Back behind is your pancreas. And over here is your liver and your gallbladder. So your liver produces bile. Your liver produces bile, and its function is to emulsify fat. What does that mean? Emulsify fat.
To
You're gonna break
Break it
down. You're gonna break it into its parts. If you will remember, lipids are not water soluble. And your body has about 97% water. So lipids are not going to mix. So we're going to have a specialized mechanism to break down these fats. And so the liver produces bile, and it is bile's responsibility to break lipids into its smaller pieces. Even though the liver produces bile, it's not stored there. It is actually stored in your gallbladder, and there are hormones that will signal when the gallbladder needs to release the bile. Okay? So, where is bile produced?
the liver,
And where is it stored?
the gallbladder.
That is an exam question. I'm glad Grace is going to get it. And I hope by the exam time you all get it. Thank you, Grace. Now, read this part. Stomach secretes acid. Yeah, okay. So over here, we have your pancreas. We've already looked at the pancreas, and we remember from our exam that the pancreas has what we call a dual function. It has an endocrine function as far as insulin and storage of carbs, of glucose, and it also has an exocrine function. We're now to the exocrine function, okay? And the main thing that the pancreas is in charge of is the secretion of HCO3 with a -1. This is the chemical formula for bicarbonate ion, and I want you to know that. HCO3 with a -1 is bicarbonate ion. Bicarbonate ion is alkaline. What does that mean on a pH scale?
It's got a low acidity.
Acids will be
Above.
Yeah.
3. No,
So pH, we've got 0 to 14, and the pH is power of hydrogen, so that is acidity. So 7.0 is neutral. This would be acidic, so low pH is acidic, and greater than 7 is a base. So we call the quality, the characteristic of being a base, we use the word alkaline. Alkaline, okay? So, for example, you're going to see in just a minute, your stomach actually secretes hydrochloric acid. That is a strong acid that has a pH of about 1.7. Way down here. Bicarbonate ion is going to be up here about 11.4. So what happens is the pancreas secretes the bicarbonate ion to buffer or neutralize, okay? You've got a 1.7 something here, and you come in with 11.4, it's gonna get closer to neutral, okay? So we can say that it buffers the acidity, okay? And we're gonna talk a lot more about that later. So the pancreas secretes digestive enzymes and, very importantly, bicarbonate ion. And then we get over here to our small intestines and highlight this. The small intestines is the main site of nutrient absorption. You need to know that. Your small intestines is the main site of nutrient absorption. And then, once we move into the large intestines, the only thing we have left is what's not any good, what we don't really want. So we're going to move it into the large intestines, and that's going to become our packaging center, okay? And it's going to get everything ready for us to eliminate it. By the time it gets into the rectum, then you're eliminating feces, all right? Your rectum and your anus are two different structures, okay? So the rectum is where it starts engaging, and that's when you recognize that you need to go to the bathroom and have a bowel movement, okay? Good. So lots of information on this little guy. So now let's keep going. I still love that guy. So how about the actual structure of the wall of the alimentary canal? I'm visual, so I'm going to go to the picture and then we'll go back and look. There are 4 layers. There are 4 layers. The outermost layer is serous. This layer is serous, a liquidy fluid that is going to minimize friction when the structure moves. I'm interested in this part. This is the muscular layer, and you see that there are nerves in that layer innervating the muscle. Why would you need that? What's the muscle going to do? It's going to contract and relax. So the nerves have to tell it to do that. The nervous system is the communication system, so it must tell the muscles when you need to do which, to move the food down our tube, okay? And then the next layer, this is going to be, what did I always say the green is going to be? Lymphatic system. And who remembers what that word lacteal means? A lymphatic capillary. Where do we want the fats that we need in our body? How and where do we want them transported? In the cardiovascular system?
No.
So it'll clunk everything up? No, where? The lymphatic system. And the place that fats from our diet enter into the lymphatic system is the lacteals, the small-ended projections, okay? The fats are going to go in here, okay? The lacteals absorb dietary fat. Do we need fat? Yes. Our cell membrane has cholesterol as its backbone. So we have to have a certain amount of lipids, okay? Now the innermost, this is the mucosal lining, and what does mucous membrane secrete? Mucus, which is a lubricant and a protective layer, okay? Now, do you see the little finger projections? Those are villi and microvilli. Can you appreciate that if I don't have this, I just go straight across, that's a very short surface area for absorption. I've got to absorb all of my nutrients right through here. So my body said, I'll show them. Instead of this short little shortcut, it's got all of this area in all of these for absorption of nutrients. Okay, that's important. You have a much greater surface area with all of those little projections. Okay, great. So if we go back, we have the mucosal layer that secretes mucus, that's the innermost. We have submucosal, that's where the cell is nourished. You've got your blood vessels, your lymphatics, and the absorption is going to occur, the muscular layer, and then the outer serous layer. There is a question on one or two of those. So how are we going to move this food? There are two major types of movement. You have a mixing movement, and it does not go in just one direction. It's gonna just shake, rattle, and roll, okay? It's going to come in here through this sphincter, close this sphincter, and get with it, and mix all of that stuff up, okay? Break it all down, all right? So it can be done in that manner, or you can move in a propelling movement, which is one-way direction, and for that we're going to use the word peristalsis. You need to know that. Peristalsis is a contraction that moves, it keeps going and moves food down the line. Okay, it goes one-way direction. One-way direction. Peristalsis. There's a question, there are 4 terms on this slide, and there's a question on each one of them on your exam. But how nice, 2 of these you already know. If we're looking at the autonomic control of the digestive system, parasympathetic impulses, would that be your cheeseburger or your lion? It's the cheeseburger. So parasympathetic increases, stimulates digestive activity. You need to know that. Sympathetic impulses, on the other hand, are going to inhibit them. Remember, we use the stimulate means we turned it on, and inhibit means we turned it off. Okay? So those 2 you already know. It's looking at innervation of the digestive tube, so where the nerves are and what the nerves do. The nerves in the submucosal plexus control secretions. You need to know that. The network of nerves in the submucosal plexus controls secretions. And you're going to see all of the secretions in just a moment. The if you have the combining form MY and then O, that is muscle. MY is muscle. This root word right here, entero, is small intestines. So we're looking at the muscles that are controlled in the small intestines. And it says control gastrointestinal. When you see this motility, think mobility. It's movement of the GI tract. GI is gastrointestinal. So you need to know these 4 things. I'm going to do a very quick overview of your oral cavity. It's hard to believe that 45 years ago I spent 4 years of my life in a graduate program studying the oral cavity and how to take care of it. I'm going to skim through rather quickly. If there is an exam question on it, I'm going to tell you, but a lot of this I'm just going to teach you so that you know for your health education and for educating patients, okay? There is one term I want you to know, and that is mastication. Mastication is the actual mechanical breakdown of solid particles, and it's mixed with saliva. So it's actually chewing food, mastication. Of course, the it is the organ of speech. Cheeks, they're wonderful, you have them. Lips, they're even more wonderful, and you have them. There we go, that was quick, wasn't it? How about your tongue? It is a very thick muscular organ that occupies the floor of your mouth. You do have some lymphatic tonsil areas for immunity that can become an irritant and problematic. And what you're going to learn, where we will start as far as lab on Thursday, is this sagittal section. You're going to need to know all of these, but you already know most of them. So I want to start with the hard palate. The palate is composed of two kind of areas. One is hard, that is bony, and it's the roof of your mouth. And then as you go more posterior, the bone is replaced by soft tissue. Okay, so we're right here. You need to know that this structure is your uvula. Now, for years, you simply named it that little hangy down thing in the back of my throat, okay? What I would like for you to do the next time you go stand in front of a mirror, say ah, and watch how cute your uvula is when it dances, and say hi uvula, okay? Because you need to know that's the name of it. It is no longer, that little hangy down thing in the back of my throat. It is a uvula, and it is the extension of the soft palate, and believe it or not, that is an exam question. Okay? Your uvula. We're going to quickly go over teeth. None of this is on the exam, but you need to, as a healthcare provider, know a couple of things. First of all, the teeth that you call baby teeth are called primary or deciduous teeth. And if you have all of them, you have 20. And they are temporary. You are supposed to lose them, okay? And then growing underneath will be your permanent teeth. And if you have all of them, then there are 32. Most of us do not have all of them. Back in caveman era, our mandibles were much larger because of what our diet was and the lack of utensils. And so our mandibles were much larger. What you do as far as your teeth, you're going to have dentition in your maxilla, which you used to call your upper jaw. Now you know that you call it maxilla. And then you have the other half in your mandible, which you used to call your lower jaw, okay? A large part of where you are headed in your healthcare journey is that you've got to be in both worlds. You've got to be able to talk to your colleagues and your bosses, your physicians, your other healthcare providers, and they're going to be talking at one level of terminology, and they're going to come in and use those words to your patient, and then the patient is going to look at you and be lost. So that person will leave, and then they're going to look at you and say what they say. And so you've got to be able to speak to the patient to get them to understand. Okay, that is a huge, very important job to have. They don't feel comfortable conversing a lot of times to the physician or the surgeon, but you're taking care of them. They're going to be comfortable and not intimidated by you. And it's such an important responsibility. Don't ever belittle it. It's very important. I don't care what your role is, you will need to balance both of those, okay? So when we're looking actually at teeth in your oral cavity, we're going to look at them in quadrants, okay? So the upper quadrant, here and here, right and left. In the maxilla, you have your front teeth. You have 4 incisors, mandibular, 4 incisors on the bottom. What do you think incisors do? Incise. They actually do. They shear and bite your food, okay? Then you have in each quadrant, you have a kind of pointed tooth in each one, and we're going to refer to that. I am going to use the word cuspid because canine makes me think of a dog, and I like dogs, but I don't want to be one, okay? So I use cuspid. That is your pointy teeth in each quadrant, and they can shear food, or probably use them to do your donut as well. And then in each quadrant you have 2. We can either call them bicuspids, because they are next to your cuspid, or you may call them premolars because they are before your molars. So you have 2 of those in each quadrant. Oftentimes, if you have had orthodontics, if you have not had room and you've got a lot of crowding in your teeth, you may have had one of each of those extracted in each quadrant, okay? And then you have 3 molars. First molar, second molar, third molar, okay? This often is called your 6-year molar, your 12-year molar, and your wisdom tooth, okay? Most people don't have room for their wisdom teeth, thank goodness. That is part of my husband's livelihood. So thank you if you donated to the Cecil Dorset Scholarship Fund. My children and I appreciate it, okay? So that is the roundhouse of dentition. No questions on it, okay? I am going to talk to you about teeth in a matter of health. Once again, no exam questions on this. First of all that little pink stuff that in the past, before today, you have called your gum, you will now say gingiva, okay? You will say gingiva. Just a note for correct terminology, if you have a G and an I next to it, that I makes it a soft G, like a J, okay? If you have an O next to that G, it's going to be a hard G, a guttural G, and it will be like good or gut, okay? And I'll show you in a minute where I'm talking about that. So this is gingiva, and we have two distinct portions of a tooth. You have the crown, which is visible in your mouth, and then you have the root of the tooth that is subgingival, below the gingiva. The teeth, your teeth, are the hardest structure in your body, and it is because of the enamel. The enamel is very strong. However, if you are not good about brushing your teeth and removing the soft plaque that will sit on the surface of your tooth, and then the sugars will metabolize it, and it will form an acidic material, and what might look like a little hole, if it starts here, what happens once it gets past the enamel is that it just flares like that. So there may be a small opening, but all of this tooth surface has been impacted. So you have to go in and remove all of this and then replace it with some type of filling material. Now you will notice this section in the interior middle of your root. You have what is referred to as the pulp, and the pulp is where you have your nerve and your blood vessels. So if the caries, if the decay goes all the way and impacts the nerve, the pulp of the tooth, you know it. I think there's nothing worse than a toothache or an earache, okay? And if that is the case, you have two choices. You may extract the tooth and lose it forever, or you may go in to a general dentist or an endodontist, and an endodontist specializes, is a DMD or DDS that specializes in root canals. They literally will drill a hole right here. They have these teeny tiny little files, and they will go in there and remove all of that nerve and those blood vessels. So you are left with a void, a space right in here. Your tooth is now non-living, it is dead, and they will go in with a warm soft material and pack this. And that is what makes a root canal. Now, often because it is non-living, the tooth will become brittle, and most often if you have a root canal, the dentist will recommend that you have a crown put on to protect the whole tooth. That's what you would call a cap. You now call it a crown, okay? Now, this is the bone, and your tooth, even if you've had a root canal, it's dead, but the bone that it's sitting in is alive, so you can still feel, you know, some of it. It's still in a living structure. We're going to call what you used to say cavities, we're going to call them dental caries, and it forms when sticky food is not removed from the surface over a period of time, okay? And of course, to prevent it, brush and floss. Yay, Dentistry 101. Now we're back to the little man, and we're talking about salivary glands. Salivary glands secrete saliva. They will moisten the food particles and bind them together. Important. Contains enzymes. And that is where chemical digestion of carbs begins, with the oral cavity and saliva. It also, saliva will have some bicarbonate ion, which remember again is alkaline. And so if you have most of the food we eat, a lot of the food we eat is acidic, so it will help neutralize it, okay? There are three major glands we're going to learn and look at. They are the parotid gland, right here, anterior to your ear. And then we have the submandibular gland. You're going to look for it underneath your mandible. And then this word, linguo. But, well, it shouldn't have two O's. Both of these terms, these root words, lingua and glossa, one is Latin and the other is Germanic. Both of those mean tongue. So where are you looking for the sublingual gland? Under your tongue. And you'll see on our mannequin, on our torso models, that's exactly where you can see them. We'll look at those on Thursday, and I'll show you that I'm going to ask that on whiteboard. So let's get back to our glands. The parotid gland is the largest, and it is serous glands, which means it's thinner and it's high in enzymes, okay? And you need to know that the parotid gland secretes amylase. When you see ASE, then you know it is an enzyme. As I've said before, the problem is not all enzymes end in ASE. But if it does end in ASE, you know enzyme. And during this chapter, we're going to put an E in parentheses around words that are enzymes, and we're going to put an H around words that are hormones, because you need to recognize how differently those two secretions work. An enzyme catalyzes or speeds up any chemical process, but it is not used up in the reaction. It simply goes in, stirs the pot, stimulates it, get it started, and then moves on to the next pot. It is not consumed in the chemical reaction, so it can be used over and over. A hormone, on the other hand, is a substance secreted by an endocrine gland that travels through the bloodstream to a target cell. So recognize when you see the words, say those things so that you remember how it acts and the characteristics. So this parotid gland is primarily serous, thin fluid. The sublingual is primarily mucus. Mucus is going to be thicker mucus glands, and they secrete mucus, which is alkaline. Just for fun, tell me what cells secrete mucus.
Sublingual one.
Goblet cells.
Goblet.
Goblet cells. So here we are. We're to the pharynx. The pharynx is a cavity that is posterior to your mouth. And what I want you to see, well, let me tell you a couple more things. It extends from the nasal cavity to the esophagus. The esophagus is a tubular organ that actually extends from the pharynx to the stomach. They're both passageways. They serve no digestive function. So let's look at them. And once again, we're going to look at the sagittal. So this is your nasal, so nose. This is your oral cavity, so oro. And this structure is your larynx. Your larynx is your voice box. That's where your vocal cords are housed. So the area that we're interested in is all this. Okay. So posterior to the nasal cavity, you have the nasopharynx. 3 parts to the pharynx. You will have to identify each of these on your lab exam. Behind the nasal cavity is your nasopharynx. Behind your your mouth, your oral cavity is your oropharynx. And then this area behind your larynx is your laryngopharynx. It's got a G and an O, so it's hard. So laryngopharynx. If you have inflammation of your larynx, that means your vocal cords are strained and you can't really talk well. You kind of squeak. That term would be laryngitis, a J sound with that G and the I. So it is laryngitis because of the I, but it is laryngopharynx because of the O. Okay, you want to sound intelligent and be able to communicate with your colleagues. Okay, and then all of this is your esophagus, and this is your trachea, which is your breathing tube. okay? So 3 parts of your larynx, your your pharynx, your nasopharynx, oropharynx, and laryngopharynx, okay? Not really any thing on your exam from this, just something I want you to be aware of and think of. We're going to use this term for chewed food, a bolus. A bolus is chewed food. So I want you to pretend you're at my house on Saturday night and Cease has grilled all of us a ribeye steak, okay? He's a good griller. So think about that piece of steak, think about cutting it up, and then take a bite. Now, if you're really thinking about it right now, you're already salivating. Okay? And then, okay, take the bite, go ahead and chew. Now I want you to think when you swallow. Okay, so my hyoid bone that supports my tongue was elevated, raised up. Okay? And the soft palate and my adorable uvula also went up. I'm going to show you on a picture in just a minute, and that's to protect the nasal cavity. Your epiglottis is going to fold over and close to protect your trachea, and then the food is going to be forced into your esophagus. So let's look at that diagrammatically. So here's your bolus. When it moves, the food moves to the posterior of your throat. Your palate, this is going to raise. And that way, food does not come back in your nasal cavity. If that's ever happened to you, it gets your attention. It is uncomfortable. You're miserable. So now the food's going to go in this direction. And very important, this epiglottis over here is straight, and it is a piece of cartilage surrounded by soft tissue that will fold over to protect. You don't want food in your trachea. Anybody ever had a piece of cornbread and one of the little crumbs decided it wasn't going to cooperate and it went in your trachea and you coughed and coughed and coughed? That's because there's not supposed to be anything in your lungs but air. Okay? So if grandma's little tiny piece of cornbread tries to go in there, your body is going to cough and reject it. Okay? And then this is going to elevate your tongue and your hyoid bone to swallow. Now we're to your esophagus. Your esophagus is a muscular food passageway that actually extends from your pharynx, which is your throat, to your stomach. It actually penetrates, it plucks a hole right through your diaphragm, okay? And we're going to look at 2 sphincters that regulate passage into and out of your stomach. Someone remind me what a sphincter is.
Squeezes.
It is a
closed.
band of smooth muscle that will contract and relax, okay, to regulate what is moving through the tube. Excellent. Write this down, this description. Your stomach is a J-shaped pouch. It is a J-shaped pouch. It receives food from the esophagus, and more importantly, you know that it initiates protein digestion. I want to go back to this next slide, and we'll come back in a minute. So, this is your esophagus here, and this is a sphincter, a band of muscle, and this is what I prefer you call it, your lower esophageal sphincter. If you use that term, you know where to look for it. It has another term, and I don't like it. It is also called the cardiac sphincter, and the reason is this is the cardia region of the stomach. I don't like that, because if I look at the cardiac sphincter, where am I going to be thinking it's going to be? Around your heart. I wouldn't have named that. So I prefer lower esophageal sphincter. However, if you are too weenie to try to spell esophageal and you put cardiac, I will not count it wrong. I will just put a frowny face on it, okay? But, because I know why. It's just, I might not spell esophageal right, okay? So, you have the lower esophageal sphincter, and then right here, you have your pyloric sphincter. So, when your lower esophageal sphincter is relaxed, and food comes through your esophagus into your stomach and it begins filling, then we're going to close here, and we're going to close here, and we're going to shake, bake, rattle, and roll. We're going to mix it all up, okay? There are four regions of your stomach. If I am asking you a region, I will denote it on the card, okay? I never asked the cardia region because I would not have named that. I do like the fundus because, y'all know I like champagne and I like bubbles and stuff. Well, when everything's mixed up, you get little bubbles up here, and they just look like they're having fun, okay? So I can remember that one, the fundus. The body is just all of this, most of it. So I might ask you the fundus, and another one I definitely know I will ask you is this little tail region here. This is the pylorus, or I usually say pyloric region. I use it as an adjective. Okay, so you have that region. There's a term right here, and it is rugae. I'm going to go back a slide. It's right here. Rugae are mucosal folds. And if I'm asking you that on your lab exam, I'm going to say gastric folds. And the reason you have those is to allow distension of your stomach. You may not have ever done this, but I unfortunately do it quite often. I eat too much. And you can feel when your stomach has distended. And that's what is happening. The gastric folds are opening up, and it's literally stretching, okay? Good. So, rugae. Okay. If this is number 23 maybe on your study guide, if I were doing short answers, this, oh my gosh, I forgot the main thing to tell them earlier. And it was my favorite thing. Okay, so four types of gastric cells and the secretion. And here's the way you're going to remember it. The cell types are mucus, and mucus cells, this is all in here in these microvilli, you'll have the different cells. So mucus cells secrete mucus. You need to know that mucus is alkaline, so it's going to buffer or neutralize the acidity. Chief cells secrete pepsinogen. What does the suffix, the ending OGEN mean? Inactive. Remember fibrinogen activated to fibrin. So pepsinogen is going to be activated to pepsin. Put in parentheses that pepsin is a protein splitter. Pepsin is a protein splitter. It is an enzyme. Then we have parietal cells in the lining, in the gastric folds. Parietal cells. Parietal cells secrete hydrochloric acid, HCl. Strong acid, 1.7 on the pH scale. Okay? The hydrochloric acid, and you must know this, there's about 10 questions from all this information on the board. Hydrochloric acid activates pepsinogen. Hydrochloric acid that is secreted by the parietal cells activates the inactive pepsinogen into the active form of the enzyme pepsin. Make a notation that parietal cells also secrete intrinsic factor. An intrinsic factor secretes B12, no, I'm sorry, I did that wrong. Intrinsic factor makes it such that vitamin B12 is absorbed. Oftentimes, well actually pretty much always, if you've ever had a gastric bypass procedure where you put a band or they actually remove part of your stomach to make it smaller for weight loss, then you will need to take B12 injections for the rest of your life because of the B12 makes it so that you can absorb your nutrients. And then last but not least, G cells or gastric cells secrete the hormone gastrin, and gastrin's message to the stomach is to stimulate all of these gastric juices, all of these secretions. Now, a way that you can remember this is, sorry guys, men can pass gas. Men can pass gas. And not only that, fellas, men pass hot gas, okay? So, not true in my family. I mean, Cecil hardly ever flops, and man, I just have a blowout. Okay, sorry. So, that's how you can remember those if you need to. So, If we were looking at an enzyme, gastric lipase, what do you think it would break down? Lipids. Lipids. A lipase, there is an exam question asking you what the enzyme lipase would break down, and it's fat splitting. It breaks down lipids. There's one more thing from this slide. This is slide 32, and I kind of did it in this fashion to help you in bullet form. The hormone somatostatin, we've heard of it before. In the endocrine system, somatostatin could inhibit both insulin and glucagon. But it also, in the gastric area, can inhibit hydrochloric acid. So it turns all of this off. That would happen when everything has been broken apart, mixed up, and broken down. So something I want to show you, if you are going to make proteins, what are the building blocks of proteins? Amino acids. If you bond this amino acid with this amino acid, with this amino acid, and this one, then you are going to make a pretty large protein. Okay? So, this guy is called a peptide bond. Okay? In order to break down this protein, for us to use it, for our body to use, you have to slice or dice or chop or dopper all of these peptide bonds so that you just have simple amino acids. That's when you can absorb them. So now that makes sense, kinda, where things like Pepto-Bismol, Pepsid, an antacid, all of those, that's where it comes from. How about Alka-Seltzer, plop, plop, fizz, fizz. We're wanting to neutralize the acidity of the stomach. So we're gonna add bicarbonate and alkaline. If you've ever taken an antacid, it's chalky. I mean, you know, it's kind of bitter, and it's to neutralize the acidity of the hydrochloric acid that your stomach is just, okay? It all kind of starts making sense. So we're going to call this enzyme pepsin, it's a protein splitter, because we're splitting that bond, that peptide bond. Makes a little sense when you kind of tie it all in together. So you must know all of this. Good. And here it is in a boring format if you want it. So how are we going to control gastric secretions? The neural regulation we've already talked about. We're going to control it with the parasympathetic impulses turned on and the sympathetic turned off. Okay? And then there are going to be hormonal regulations. We talked about somatostatin, and we know that gastrin is the hormone that will stimulate all of the gastric juices. Okay, you need to know those. Boring. So there's very little absorption that actually goes on in the stomach. Some lipid-soluble drugs might, some alcohol, but very little. It's mainly just mixing, breaking up everything, okay? So a couple of, another term I want you to know, we used bolus, and what was that? Chewed food. We're now, when the food is in the stomach mixing, and it's got all the gastric juices and the hydrochloric acid, we're now going to call this chyme. Chyme, you need to know that term. C-H-Y-M-E. Chyme. And you're going to see that it's going to move slowly through the pyloric sphincter, and the next place that it is going is the first part of your small intestines, which is the duodenum or duodenum, okay? Once again, you see this word entero, and you see gastric. Entero is small intestines, gastric is stomach, and the enterogastric reflex is when the pyloric sphincter is stimulated to be dilated, and the chyme actually starts moving into the duodenum, okay? A couple of terms I'd like for you to know, and I can never remember which one is on your exam, so you get to know both. We know that the combining form for stomach is gastra. So 2 terms, please. Gastritis is literally inflammation. Of the stomach. And then the other one is gastralgia. The suffix A-L-G-I-A, algia, is pain. So gastralgia literally means stomach pain or a stomach ache, okay? Good. I'm gonna go on and do y'all wanna take a quick break? And I'm gonna go on about 30 more minutes if y'all want a break. Or I'll just keep going. Okay, I'll keep going. So let's look at the pancreas. We remember that we said in the very beginning with the endocrine system that it was a dual function organ, and for the endocrine gland, it actually helped regulate blood glucose. For the exocrine gland, it's going to secrete digestive fluid that we're going to call pancreatic juice, okay? Let's go to the picture. So this is your gallbladder. This is your pancreas, all right? This C-looking structure, it's actually C-shaped, and the pancreas is nestled in here. This is the only fixed portion of the small intestines. All right, and this is the duodenum. Now, you may pronounce this most superior portion of the small intestines two different ways, and it is your choice. Duodenum or duodenum. Either is correct. And I actually will use both depending on what I'm combining it with. If you are talking about a surgical opening of the duodenum, then I'm going to say duodenostomy. Or I could say duodenostomy. Both of those are correct. It just depends on how I've got to get the rest of my other words and vowels out because my tongue can get twisted. Okay? So what we're looking at close up right here, this is your bile duct coming from your gallbladder. This is your pancreatic duct coming from your pancreas, and they both open right here. This ampulla means opening. So that opening is called the hepatopancreatic duct. Why do you think it might be hepato instead of the cholecyst for gallbladder? What's coming down that duct? Bile. It's where the bile duct and the pancreatic duct combine. Where is bile? Thank you for the donuts. You take them with you.
No.
You can't leave all those.
It's for the class.
Well, they got them what they want. Look at her. She's running. Hey, she's going to get hers, Ashley. I love y'all.
Yeah, it's just.
Yeah. Take okay, leave them here. We'll all get fat. You got a reason for that little pooch, girl. You cute. Sorry. She's so cute. So, I'm sorry, where is bile produced?
The liver.
In the liver. What is the function of bile?
Break down fat.
Emulsify fats. Perfect. So hepatopancreatic ampulla, and then, oh my goodness, we're going to have to regulate in and out. So we're going to have the hepatopancreatic sphincter, okay, that will dilate or contract. Great. Oh, here we go again. Okay. So, now we're moving on down. We're looking at the pancreas as an accessory organ. So, what are our pancreatic juices? It has enzymes that digest 1, 2, 3, 4, big 4. Carbs, lipids, proteins, and nucleic acids. Okay, so let's look at these. Amylase breaks down the sugar amylose. So you're going to have, this is a sugar splitter. It's a carb splitter. It's going to break down carbs. Pancreatic amylase. Okay, how about pancreatic? We've seen this before. What is lipase going to break down? Lipids, fats. It is an enzyme, ASE, and it's going to break down our triglycerides. Now, for these, I want you to combine these three. And I'm going to call these proteases. ASE, enzymes, and it is enzymes that break down proteins. Okay? One is trypsin, the other one is chymotrypsin, and then peptidase. So recognize that proteases break down your proteins. And then, this is also an exam question, nucleases would break down nucleic acids. Your pancreas, your secretions in the pancreas have enzymes for all four of the big four. And then there's one super important that is not an enzyme. It also has bicarbonate ion with a fire hose, because when you are leaving, the kind that is leaving your stomach is highly acidic. Your stomach, by design with the rugae, is protected. It can, it is enabled to be okay in that high acidic environment of hydrochloric acid. Your small intestines lining, not so. So literally, when you go back here, I envision right here a huge, I don't even know how to draw a fire hose. I'm gonna put a nozzle. And then this is my hose, and here is bicarbonate, boom, coming right here, because acidic chyme is coming right there. And if you are going to get an ulcer, a very likely place is a pepsid ulcer, and it's right here, because that acidic chyme is coming straight from your stomach. Okay? Great. So remember that your pancreatic juices are your big four enzymes and bicarbonate ion. Lots on this test, okay? Good. And to regulate the pancreas, we're going to have a special hormone, and the special hormone is secretin. You must know that secretin is a hormone that is going to stimulate the pancreas to secrete bicarbonate ion. Secretin is a hormone that is going to stimulate the pancreas to secrete bicarbonate ion, which is going to neutralize the very acidic chyme. Okay? We're just going to do a few more. Thank you for hanging in there. So, when we're regulating pancreatic secretions, there are two hormones that we're going to look at, but I'm going to separate this one. Secretin, put a big H by it. Secretin is released by the pancreas, and its function is to stimulate bicarbonate ion. The function of bicarbonate ion is to buffer or neutralize the acidity of the chyme. And we're going to look at CCK in a minute. So let's go ahead while we're doing a roll here, and do look at the liver. It is the largest internal organ. It is located in the upper right abdominal quadrant, really wedged in under the diaphragm. It's reddish brown and very well supplied with blood vessels. And there are 4 lobes of the liver. 4 lobes of the liver. The right lobe is large, it's the largest, and when you're looking at it straight on, right lobe, left lobe, then you have to turn it over to see the other 2 lobes. And this is more lab question. So there is this area is the caudate lobe. This area is the quadrate lobe. Now, here's my suggestion. If you can think of something other, you can do it. So right and left are easy. Then on the back, this is your inferior vena cava, the big blue vessel. Inferior, when I think of inferior, I think of tail. If I had a tail, it would be here, and a tail is caudal. So I just try to remember that the lobe next to the inferior vena cava is the caudate lobe. So that's right, left, caudate. How many lobes do I have of the liver? 4. And so the 4th one is 4 is quadrate. It's up by the gallbladder. If that helps, use it. You know, I don't know, but I will ask you to identify all of those lobes because it's pretty easy. Okay? That's lab exam. Go away. Hey, oh, you mean totally go away? Should we stop? Okay. I get the message. Didn't y'all? I don't know what I did, but okay. So, yes. When is the lab test? The lab test is like the last week of finals.
Oh.
Yeah. We're gonna, normally I will do several, don't I just have 2 this time? Yeah. It'll be digestive, respiratory, urinary, and reproductive. Okay? It sounds like a lot, but you got plenty of time as we go through it. If it works out that we have time, I could break it up. I like to just do the, what's it called? You know what? Maybe I'll do